Okay, so let's talk about some shit that gets left out of the rehab brochures. You're 3 months sober, you're 6 months sober, maybe 2 years, maybe 3 fucking years. And you're thinking, why do I still feel flat? Why am I bored? Why am I restless when I'm doing everything right? Here's what's actually going on, and it doesn't mean that you're doing anything wrong. So for a long time, the substances were doing the things for your brain that it normally would do on its own. So like dopamine, which is your reward, motivation, pleasure chemical, was being artificially elevated in your reward system. So your brain did what it does and it adapted. It pulled away dopamine receptors. Basically, it said, hey, we've got all these receptors here, but we keep getting fucking flooded. So we don't need all these receptors here. So it starts pulling them away. So now you take away the substance, which is good. But those dopamine receptors are not going to just pop back in overnight. They're going to take time. It took you time to cause the damage. It's going to take time for the damage to heal. They do regenerate slowly, gradually, with repetition, consistency, and a supportive environment. And then there's glutamate. Glutamate is your anticipation chemical. It's your something is about to happen signal. In addiction, your glutamate system gets hijacked. It learns one shortcut: substance equals relief, excitement, escape, whatever. So even in recovery, your dopamine might be low and your glutamate is still scanning the environment like what's gonna fucking happen. And what that feels like is boredom, restlessness, irritability, emptiness. It's not a failure, it's healing. In part 2, we'll talk about how to fix dopamine and glutamate, but without toxic positivity or pretending motivation magically appears. Don't forget to like, share, follow, save, and stay tuned for part 2.